Hello, and welcome to the presentation on test-taking strategies for NCLEX-style questions. I'm Tess Luffelman, and your host for today's presentation. All of us have taken exams and know test questions are designed to check your knowledge. Information you may have learned in class, reading assigned chapters, or learned from your clinical, simulation, or lab experiences. However, knowledge-based questions are not the only type of questions encountered in a nursing program, right? In addition to learning nursing content, you soon realize that to successfully pass your nursing exams, you must also have an understanding of how to read and interpret NCLEX-style questions. Understanding how to interpret NCLEX questions is fundamental to your success. This presentation is designed to strengthen your test-taking skills. We'll focus on a variety of test-taking strategies, essential steps used to answer test questions, and specific strategies used to answer prioritization questions. Then we'll practice the presented strategies by answering NCLEX-style questions throughout the presentation. Understanding key strategies is essential in answering NCLEX-style questions correctly. The key testing strategies we will cover are: identify the question stem, identify keywords, is it a positive or negative style question, rephrase the question, expose and read one choice at a time, and rule out options. Identify the question stem. The stem is the part that asks the question. An example may be, what priority action should the nurse include in the patient's plan of care? Or what should the nurse do next? After you read the scenario and choices, read the question again. Make sure you understand what the question is asking. Look for keywords. Ask yourself, which words or phrases provide critical information? The information may be symptoms, the client's age, or a nursing priority action might be needed. It's very important to read every word of the question. Is it a positive or negative style question? A positive style question may ask, which prescription will the nurse most likely hold? Or what is the best or first action the nurse should implement? Some of the strategic words or phrases you may read in a positive style question are early, best, most likely, select all that apply, and order of priority. A negative style question may ask, which behavior indicates the need for more teaching? Or which intervention is the nurse least likely to implement? Examples of strategic words or phrases in negative style questions are needs additional discharge instructions, least likely, or ineffective. Rephrase the question. Why is it important to rephrase the question? Rephrasing will help you eliminate non-essential information, also known as distractors. Rephrasing will help you determine what the question is really asking. Is it looking for an assessment finding, an intervention? Do you need to prioritize? You should also rephrase the question before you look at your answer choices. The next strategy, expose and read answer choices one at a time. Make a decision, consider your rationale, and then move on. Don't read too much into your choices or overanalyze. Don't change your answers. The first answer is usually the correct one if you've taken the time to reason through the question. The no but principle. If you find yourself including but in any part of the question scenario, your answer choices or rationale, then most likely your answer will be wrong. By adding but, your answer is based on inaccurate or changed information. You might read the question and think, but maybe the nurse already provided discharge instructions, or, but the patient could have already taken their medication. Stop. It's very important to stop yourself from reading into the question. Rule out options. Rationalize why each option is either right or wrong. You can usually identify one or two options that are clearly the correct choices. If only two choices can be eliminated, write down the rationale for the two remaining choices. Reflecting on what you know about the subject and related principles will help you differentiate between the two remaining options. Reread the question, make your decision based on which rationale is more reflective on what that question is asking. Don't pick an answer just because it sounds right or you believe it to be true. It must answer the question. There are 4 essential steps in answering NCLEX-style questions. Find the key words in the question. Determine if the question is a positive or negative style question. Rephrase the question and rule out your options. A client with suspected active lung tuberculosis is being scheduled for diagnostic tests. The nurse anticipates that which diagnostic test will most likely be prescribed to confirm the diagnosis. What are the key words? Active TB and confirm. A client treated for an episode of hypothermia is being discharged to home from the emergency department. The nurse determines that the client needs additional discharge instructions if the client states intentions to. What are the key words here? Hypothermia and discharge instructions. Both provide you with critical information. Using the 2 previous question scenarios, we'll now apply the second step of answering a test question to determine if the question is positive or negative. A client with suspected active lung tuberculosis is being scheduled for diagnostic tests. The nurse anticipates that which diagnostic test will most likely be prescribed to confirm the diagnosis. Is this a positive or negative style question? Positive. Strategic words are most likely. A client treated for an episode of hypothermia is being discharged to home from the emergency department. The nurse determines that the client needs additional discharge instructions if the client states intentions to. This is a negative style question. The strategic phrase is needs additional teaching. Rephrasing the question in your own words is the 3rd essential step of answering a test question. A woman admitted to the hospital in preterm labor has been treated successfully. The client is being sent home with an oral regimen of terbutaline. Which of the following statements, if made by the client, would indicate that the client understands the discharge teaching about the medication? What is the question really asking here? You can rephrase with, what is true about terbutaline, or what did the client say about the medication that was true? A client treated for an episode of hypothermia is being discharged to home from the emergency department. The nurse determines that the client needs additional discharge instructions if the client states, rephrase with, what statement about hypothermia is incorrect, or you can rephrase with, what did the client say that shows they need more teaching? The 4th essential step is to rule out options. A client has metastatic cancer and is receiving continuous IV infusion of morphine to alleviate pain. The nurse monitors the client for which life-threatening effect of the medication: nausea, lack of appetite, dizziness, or severe respiratory depression. First, we need to go through the other 3 steps. The first step is to identify the key words. The key words are morphine and life-threatening. Applying the second step, we find that the question is positive. And in the 3rd step, we can rephrase the question with, morphine can cause which life-threatening effects? Now we can go to step 4 and rule out options. Nausea, is it life-threatening? Lack of appetite, life-threatening? Dizziness, life-threatening? Severe respiratory depression, life-threatening? Yes, this is the correct answer. Remember, when you rule out options, you need to be able to rationalize why each option is either right or wrong. What are prioritization questions? Those are the questions that need you to decide which client needs or problems require immediate actions and which ones can be delayed till a later time. Priority questions often have more than one right answer, but there's always a correct action to choose first. When prioritizing your nursing actions for prioritization questions, you should consider ABCs, airway, breathing, circulation, Maslow's hierarchy of needs, or the nursing process. A few strategic words associated with prioritization questions are first, initial, or best. Choosing the right answer often involves choosing the best of several answers that have correct information, and as such requires careful reading of all of the answer choices. ABCs, airway, breathing, and circulation. If the option addresses a patient's airway, then airway will be the correct option. If none of the answers address airway, move to breathing followed by circulation. Remember, ABCs must be relevant to the situation. Nursing interventions that focus on airway problems or nursing interventions to manage the airway receive top priority. A client with a diagnosis of cancer is receiving morphine sulfate 10 milligrams sub-Q every 3 to 4 hours for pain. When preparing the plan of care for the client, the nurse includes which priority action? Monitor stools, encourage fluid intake, monitor urine output, encourage the client to cough and to breathe. Applying the 4 essential steps of answering a test question, we know the key words are priority and morphine. It's a positive style question. And we can rephrase the question with, what is most important when caring for a patient receiving morphine? The strategic word priority tells us to use the ABCs, if applicable to the situation, to guide us to the correct answer. Now we can rule out our options. All 4 options are part of the plan of care, but only one is going to be the priority. Morphine depresses the respiratory and cough reflex, making choice D the correct answer. If ABCs are not applicable to the question, then considers Maslow's hierarchy of needs. Maslow theorized that human needs are satisfied in a particular order. Maslow's is also used with questions that focus on patients with multiple health issues or complex patients. When you use Maslow's hierarchy of needs, address the physiological needs first, followed by safety and security, then love and belonging needs, followed by self-esteem needs, and then self-actualization needs. Physiological needs are in the first tier and come before safety and security. Examples of physiological needs are food, water, sleep, or pain. When a physiological need is not addressed in the question, look for the option that addresses the second tier, safety and security. The second tier, safety and security, can be both physical and psychological. Physical safety can be related to an illness, accident, or an environmental threat. To be psychologically safe, the client must have the knowledge about what to expect from others. You may find psychological safety needs embedded in patient teaching questions. A client with a history of bipolar disorder is admitted to the psychiatric hospital. Her husband reports that she has not eaten or slept in 2 days, and he suspects that she has stopped taking her lithium. On admission, the nurse should place the highest priority on which of the following client care needs. Teach the client the importance of taking lithium as prescribed. B, provide the client with a safe environment with few distractions. C, arrange food and rest for the client. Or D, setting limits on the client's behavior. We'll use the 4 steps of answering a test question. The key words are bipolar, stopped lithium, and not eaten or slept for 2 days. It's a positive style question, and we can rephrase the question with which client need is most important for this patient. What type of priority question is this? Would you prioritize your nursing actions based on ABCs or Maslow's? ABCs didn't apply, but Maslow's does. Rule out our options. Option A, teach the client the importance of taking lithium as prescribed, and option D, setting limits on the client's behaviors, are psychological needs, which are the second tier of Maslow's, so we can eliminate both options. Option B, providing a safe environment, is also on the second tier of Maslow's, which makes C the correct answer, arranging food and rest for the client. Remember, food and rest before all else. Look at the first tier. If the ABCs and Maslow's are not applicable to the prioritization question, then consider the nursing process. What's the acronym for nursing process? ADPI. You need to determine what step of the nursing process is being asked for in the question. Assessment questions include gathering and verifying data. Questions pertaining to a diagnosis require the nurse to interpret the data and collect any additional needed information, or identify and communicate the nursing diagnosis. Planning questions will ask about determining or prioritizing and modifying outcomes of care. Intervention or implementation questions reflect the management and organization of care, as well as the assignment and delegation of tasks. Then evaluation questions can focus on comparing the actual outcomes of care with the expected outcomes, and on communicating and documenting the findings. Use ADPI to look for an assessment data collection action in the options. Assessment should always be done before any nursing interventions are done. If the question is asking what additional assessment does the nurse need, look for an assessment answer. Eliminate the answers that are intervention-based and focus on assessment choices. However, if assessment is not addressed in one of the options, then continue using the nursing process in a systematic order. Go to diagnosis, then plan, intervention, and evaluation. Strategic words in an option that include assessment may be ascertain, check, determine, monitor, observe, identify, or ask. The nurse cares for a client with a diagnosis of CBA. The nurse is feeding the client in a chair when suddenly he begins to choke. Which of the following actions should the nurse take first? Check for breathlessness by placing an ear over the client's mouth and observing the chest. Leave the client in the chair and apply vigorous abdominal or chest thrust. C, ask the client, are you choking? D, return the client to bed and apply vigorous chest or abdominal thrusts. We can answer the question by applying the 4 essential steps. The key words are CBA, choke, and first. It's a positive style question, and we can rephrase the question with, what is the most important thing to do when an alert patient begins to choke? Is this an ABC, Maslow's or nursing process question? It's nursing process. So we'll start with ADPI. Rule out our options. Check for breathlessness by placing an ear over the client's mouth and observing the chest. Is the patient unconscious? No. So you can eliminate option A as an answer. Option B, leave the client in the chair and apply vigorous abdominal or chest thrusts. Is this an assessment or an intervention? It's an intervention, so we can eliminate option B. Option D, return the client to bed and apply vigorous chest or abdominal thrust. Is this an assessment or intervention? It's an intervention, so we can eliminate it. Option C, ask the client, are you choking? This is the right answer. Ask the patient if they are choking. We need to assess first. Testing with NCLEX-style questions does not have to be challenging. Use the test-taking strategies and the 4 essential steps of answering test questions presented here to help you be successful on your next test and ultimately your NCLEX success. Remember, test taking is a skill, and as with any skill, requires practice. Additional opportunities to practice your test taking skills will be offered in our upcoming NCLEX practice questions with rationale sessions. Please contact a nurse tutor for additional information on the upcoming sessions, as well as any questions you may have on the information covered in this presentation. I appreciated the opportunity to support your success, and thank you for attending the presentation on test-taking strategies for NCLEX-style questions. Take care.